is careers in healthcare. We're going to cover some of them in here and talk a little bit about the different careers and paths that you can take and things like that. There's no way that we can cover all the different careers in healthcare. There's just too many. When we're normally in class, I always like to ask students to take a minute and think about some of the healthcare careers there are out there. And a lot of times I ask how many they could actually list. If I gave you a minute, how many do you think you could list? And I have them start to write them out because I want students to kind of think of some of the more common careers out there, but I want them to realize that there's so many that we don't even think about on a daily basis. In fact, there's over 250 different healthcare careers out there. All of them obviously are going to vary in what the educational requirements are, depending on many factors, and even from state to state. But basic prep can begin in high school for different healthcare careers. And that's always kind of been the case, but it's even more now with all the different programs there are and the dual enrollment. Students are able to start those healthcare careers a lot sooner. If you're somewhere where you have a career center or career prep, like we do here in Jackson, you can even take classes there and graduate with some sort of certificate programs as well. So, a lot of times when we think about healthcare careers, the first thing that comes to our mind is doctors, nurses, or what your future career is. But there's a vast variety of different careers out there. I like to talk to students a lot about their healthcare careers and why they're choosing it, and what makes them motivated to want to be in a healthcare career. And I kind of give them a little breakdown of mine. I mean, not all healthcare careers have to be this, altruistic reason of why you're wanting to go into it. I didn't have that. I mean, when I was looking at what I wanted to do with my career, I was a young mom. I was very young, in fact, a teen mom, and I had my daughter, and I realized that I needed to make something in my life for her. So I needed to find a career that would be capable of supporting us, that would be doable for me raising a child by myself. So I started looking through the book at JC, and I mean book. Back then, we didn't have computers where I could look at the different career paths. I actually had a catalog that I would go through and see what my options were. And that's where I kind of settled. I actually picked ultrasound to begin with and was going into that career, and then radiology ended up piquing my interest, and that's kind of where I fell. I was actually looking at what career can I go into where I can make enough money and go through the Lee schooling. I know that sounds terrible, but that's what I did. And it worked out really well for me because I love what I do. It was the best decision I ever could have made for myself and my daughter and my family now. So I'm very thankful for that. But I didn't put a lot of thought into it. And I would like to encourage you guys to put a little bit more thought than I did. So there's some questions that I like to ask students to kind of get you thinking about healthcare careers and why you're motivated to go into the healthcare field. So is healthcare in your future? Tell me why. Are you inspired to help others? Now, like I said, I didn't have some huge aspiration to help others. That wasn't my motivation. I do love that. That's something that I didn't realize at the time that was a good motivation for me. So, my answer to that would be yes. Are you excited about lifelong learning? It's very important as healthcare workers that we continue to learn and stay up to date on the latest studies and trends and treatments. So you need to be aware of all those things to provide the best care to your patient. A lot of healthcare careers are required to take continuing education credits. How many are you going to need? Now, when I say that, a lot of people think that means taking college courses, and that's not what it is. Another question is, what types of skills are necessary for a healthcare career? Now, I'm not saying each individual one, but there's some skills that are pretty much required of all of the different careers. Some of them are dependability, teamwork, compassion, organization, and the ability to multitask. Those are some pretty basic skills that every healthcare career is going to need. So ask yourself, are you capable of those things? Are you dependable? Well, I wasn't in high school. I had a first hour teacher that told me I should never get a day job. But once I had a kid, that kind of changed because I was forced to get up in the mornings. But, you know, can you work as a team? Do you get along with other people? You know, when we are working in a hospital, we have to work together as a team to give the best possible care to our patient. We have to work close with, the emergency room, the floors, the doctors, the nurses, the aides, the transporters. Everybody in the hospital has to work together to ensure that our patients are getting the care that they need. Can you deal with pressure? Pressure is a daily part of many of the healthcare careers. You have to be able to handle it and thrive in it. You have to be able to do well. Do you have a strong work ethic? Do you think that you'll be able to go above and beyond in the patient's care and service of others? Like I said before in one of the last slides, if you listen, that's not my job. If you're walking in the hallway and someone stops you and asks you a question and it isn't part of your job, that doesn't matter. Our job is the 100% total care of a patient. So we need to either figure out for this patient what we can do for them, or direct them in the right way, or get someone that can help them. Do you have a positive mental attitude? There's going to be difficult days in the healthcare careers. You need to see the bigger picture and not get stuck in those tough days. I'm sure all of you have probably worked with a negative Nancy in your career, and it's really, really difficult to work with somebody that's always negative. So having a positive attitude can really help you go a long way. Even if things are struggling at home. If I'm having a bad day at home, or my kids are driving me nuts, or my fighting with my husband, I don't take that stuff into work with me. I use work as my outlet. Like, that's where I'm going to go, and I'm going to have a good attitude, and I'm going to help my patients, and I'm going to have a good day. So we need to be able to mentally, prepare ourselves for those kind of things. Are you flexible? I don't mean physically, I mean with your time. Can you cover an extra shift? What if your boss says, hey, can you stay late today? So and so called in, or we're really busy right now. Are you going to be flexible enough to do that? Most healthcare jobs are not 9 to 5. You can be mandatory to work, you might have call. Not every job is going to be like that, but I just want you to be aware. That's one of the things that I didn't know when I was applying to ultrasound. I didn't realize there would be call. Nowadays, it's not as frequent because most facilities run 24/7. But that was something that I didn't realize. And even when I followed my career into radiology, I worked on call in radiology for quite a while. So there's a possibility of that depending on your career. Do you have self-confidence? Now, when you're first starting out and you're a student, you're probably not going to, but you don't want to show necessarily your lack of self-confidence to your patients. No one likes to think they're being cared for by someone who doesn't know what they're doing. So you just need to project self-confidence even in a time when you don't have it yet. So when I talk about some of these things, you need to be honest with yourself, assess the skills that you currently have, and think about the ones that you need to work on. I'm not saying that, you need to have all these right now, or if you don't have these, then you shouldn't go into healthcare. That's not what I'm saying, and I'm not trying to scare you away. I'm trying to make you aware. Because we can change. I mean, I'm a completely different person than I was 10 years ago or 20 years ago when I started my career. Ask yourself, what kind of people do you work with? What do you think the people that you work with on a daily basis are like? Some are going to be caring and helpful and compassionate. Some will be really team oriented. But you're also going to work with people who are selfish and lazy, or maybe even difficult to get along with. Can you deal with those things? So what do you think your typical day is like? When you go into work, how's it going to be? Is it busy, fulfilling? Can be rewarding, right? If you're helping patients, depending on what your career is, you could be curing them, you could be giving them a proper diagnosis, you could be assisting them in treatments. It can be stressful or sad, in the same sentence. If you could lose a patient, or watching them suffer, or you could just have a day where things go completely wrong. And then you're going to have a day that's absolutely wonderful, where you have patients that give you a hug and tell you that you're the kindest person that they've ever met. Think about the job that you want to go into. What's your salary going to be like? How much education is required? And what's the outlook for your career in the future? Now, those are some of the questions that you're going to be answering in the career research paper outline that's going to be due. So, starting to think about those is good. Are you comfortable working in a fast-paced healthcare setting, or would you prefer something slow? You don't have to work at a hospital. You can work in clinics or doctor's office that tend to be a little bit more slow-paced. But most of the time, you just never know what you're going to get. You don't know if it's going to be a busy day or a slow day. So there's some things I'd like you to think about when you're picking your career, and most of you might already have something in mind, and that's perfectly fine. So think about what interests you the most. Think about if you like working with others or if you prefer to work alone. Maybe you would prefer to work third shift and be by yourself. Are you good at explaining tasks or concepts? So depending on the career you're going into, like for me in radiology, I have to explain a lot to my patients. I need you to stand here. I need you to do this. I need you to turn towards me a little bit. I need you to follow my instructions. There's a lot of communication that goes on between me and my patients. Are you comfortable helping someone you don't know? Are you comfortable touching people you don't know? That can be a tough one in the beginning. I've always been a person who doesn't really like to be touched by other people that I don't know. And I had a hard time when I first started my clinicals as a student touching patients. It was something I got over very quickly, and now I don't even think twice about it. But it was something that I hadn't thought of in the beginning when I first started my career. Can you deal with bodily fluids? Vomit, blood, urine, feces? Those are things that you might have to deal with if you've got a patient who isn't feeling well. And how do you handle life and death situations? I mean, that could be very rare and few and far between when you're working in different careers. But I have had patients who have coded on me and needed CPR performed. So there are times where you're going to have to deal with that. And then what lifestyle do you envision? Healthcare careers could have long hours, weekends, holidays, or call. So, all of those different things are going to play out as you, um, start to pick your career. So, how to find the right career for you? I always tell students to answer these questions to help. Think about how long you want to attend school. Is that a deal breaker for you? Do you want to go for 2 years, 4 years? You don't care. You want to go for 10 years. You know what you want to do. What kind of salary suits your lifestyle? That can be a big thing, right? If you have kids, if you are wanting to make sure that you make a certain amount of money, if you just need a little bit, to help kind of supplement your family's income, there's a lot of different things out there. So think about what would work for you. Again, I said this before, but what's the career outlook for your desired career? Are there jobs? Where do you intend to live? If you're planning on living in a certain area, you know where it is. Look in that area to see where the careers are and what they're like. Do they have increased or decreased needs? Think about what skills are needed and if you possess them. And if you don't possess them, do you think that you could work towards obtaining them? And then ask yourself, why do you want this career and does it fit me? Now, one of the things that I've always recommended over the years is if you have an interest in a job or a career, but you're not 100%, I always recommend students do a job shadow. A job shadow is where you actually go into the career that you're thinking about and observing it for a day or a half a day or something like that. Now, I don't know if hospitals are allowing that right now. But it can't hurt to reach out to the department that you're trying to go into that career. So if it's sonography, reach out to diagnostic imaging and sonography department at the hospital near you and ask them if they're still doing job shadows or if you could come in. If you're lucky enough to know somebody, maybe you can get in that way. But I highly recommend job shadows because it gives you a better insight of what that career is really like. I know it's just one day or a couple hours, but still, I think sometimes students don't really realize all that's entailed in a job until they're already, halfway through it. So there's a lot of different educational paths for careers. So the health science education, the SAG, these are programs that can prepare a student for immediate employment in many healthcare careers or for additional education after graduation. So like I talked about, some of those career preps, you could graduate with like an MA certificate or a phlebotomy certificate right out of high school. Or they can prepare you to continue your education in college after you graduate. There's also post-secondary education, which means after high school. So that can be training in like a career or a trade school, tech school. It can be a community college or an accredited online program or a university. There's a lot of different career paths in the post-secondary education. So most healthcare careers are going to require one of three things: either a certification, a registration, or a licensure. So these are methods that they use to make sure that an individual has the skills and competency of a healthcare professional. So in a sense, they're just requiring these to protect the patients. So again, certification, registry, or licensure, it depends on what you're going into. So a certification is essentially when an individual learns the skills, takes the classes, or goes to clinicals, and then they pass some form of assessment to be considered certified. That certificate vouches for that professional's skills and competency, and then they can take their certification to their employer as proof that they know how to do their job. So examples of certification are like a certified medical assistant or possibly a dental assistant. A registration might be required in some other healthcare careers. A registration is actually performed by a regulatory body. They administer the exam. So your school prepares you for the registry, and then you go to this regulatory body. Usually, it's depending on what your career is, but there's an association that does them. So just like you would with your certification, you'd take your healthcare classes, you'd do your clinicals, you would take a registry exam, usually by that profession's like their association. Like for me, for radiology, it's the American Society of Radiologic Technologists. That's who gives me the registry exam. And that professional organization, they also maintain a current list of registry qualified personnel in that health area. So with that, if I'm applying for a job, my name is on that list. So if I applied for a job in radiology, the department manager could just look up on the website and see whether I'm registered or not. You can search by name. A licensure is a little bit different. That's a process in which a government agency gives an individual permission to practice an occupation. So it's most common in healthcare, and doctors and nurses are very tightly regulated to ensure proficiency in public safety. To become a licensed professional, you have to meet eligibility requirements. You have to pass at least one assessment. And a license can have stipulations about the scope of practice, or like the scope that an individual can practice in. And it also tells them what their ongoing learning and renewal process is going to be. So they have to pass that state board exam and maintain those certain practices. But like I said, it also has the stipulations about the scope of their practice. So like that's saying like an orthopedic physician can only specialize in orthopedics, pediatrics. So they have to stay within their scope of their licensure. They can't venture out of it. So examples of people that would have a licensure are dentists, physicians, or registered nurses. An accreditation is an agency recognizing that a separate organization has met certain standards and criteria. And those are, a person is required to graduate from an accredited program before they do their certificate, registration, or licensure. So like Jackson College is accredited. So if you went through a college that was not accredited, when you went to sit for maybe your board exam or your registry or your certification, they could deny you even taking that test because the schooling that you went through wasn't accredited. So what they're essentially saying is, we know that this school is meeting the requirements to ensure that you are at a certain standard or criteria. So accreditation just applies to the safety and efficiency of the programs. So always make sure, if you're ever going through a college or program other than Jackson College, that it's accredited. So I can vouch for Jackson. CEUs, you probably heard me mention those a couple times. CEUs stand for Continuing Education Units, or credits, we call them a lot of times. Those are required to renew your license or maintain certification or registration in many states. So like for me, for my career, I'm required to maintain 24 hours of continuing education credits every 2 years to keep my registration up to date. If I don't do that, I'll be in violation of my registration and I would not be able to work until I get those updated. And they can actually take it away from me, and I would not be able to be a radiographer in the state of Michigan if I didn't meet the requirements. So, like I said before, you don't have to take college classes. Usually what I do is you can either go to seminars, and those will give you credits, or I read a lot of medical journals, and then I take tests online on the medical journals. And usually each test is worth about 2 credit hours. So each licensure or certification or registry might be slightly different on what's required of them. So it's important that you know what is required of you for your healthcare career. Healthcare workers must know the requirements in their state too as well, because it can vary from state to state. Professional organizations. So these are something that represents the profession that you're working in. It's an organization that can do a lot of different things for you. So like I said before, the organization for my profession, for radiology, is the ASRT, the American Society of Radiologic Technologists. For ultrasound, it's like ARDMS, the American Registry of Diagnostic Medical Sonographers. And, there's one for just about every medical profession that you can think of. But some of the benefits of them are they provide professional development, so they can provide publications, seminars, conferences, and continuing education credits. They have a lot of career information, so sometimes they list jobs. They can promote healthcare careers by giving information. They can also influence legislation and advocate laws for your healthcare career. In some states, it wasn't mandatory that a radiographer would need to be registered. So, some people were going to school, doing the right things, and people who had no schooling at all were taking jobs from them. So, they were fighting for the registered technologists in those states. They can help you with certification, registration, and licensure. They can also offer some financial support by providing grants for research or education or even scholarships. And another thing that they do is they establish a standard of conduct or code of behavior for each profession and tell you, how you should behave within your career. So there's different levels or training levels for a lot of different healthcare careers. We categorize them into 4 different levels. The first one is a professional, which means that person has 4 or more years of college. They can either have a bachelor's degree, a master's, or a doctoral degree. So that could be an MD, a medical doctor, a dentist, or a pharmacist would be examples of that. A technologist or therapist is someone that has 3 to 4 years of college plus work experience. Usually they have a bachelor's degree, but not always. And some examples of that would be like a physical therapist or a speech therapist. A technician is a person that has a 2-year associate's degree and a special health science education. So examples of that could be like a dental laboratory tech or a surgical technician. An aide or assistant is someone who has a specific number of hours of specialized education or 1 or more years of training combining with that classroom work or on-the-job training. So an example of that would be a dental assistant or a medical assistant. So I don't know if you've ever heard of the term multi-competent or multi-skilled workers, but it's something that's kind of it's not really new, but newer trend in health occupations due to the high health cost. So what it simply is just workers can perform a variety of healthcare skills. So a lot of times in smaller facilities, it eliminates the need to employ specialists for every aspect. So there's even educational programs that help prepare these people. So a lot of times it can be like um, a phlebotomist works as a medical assistant, or a medical assistant works as a phlebotomist, or an x-ray tech works as an MA at small facilities. Not only do they perform the x-rays, but they'll room the patients. A lot of smaller facilities utilize people in that way because it doesn't make sense for them to have a phlebotomist, an x-ray tech, and an MA when they're very low volume facilities. So they can save a lot of money that way if one person can do those tasks. So there's a lot of different educational requirements to healthcare careers. They can vary greatly. Um, there can be on-the-job training, so training essentially while you're working. There's an associate's degree, which is a 2-year degree, a bachelor's degree, which is a 4-year degree, a master's, which is 1 or more years beyond a bachelor's degree, or a doctoral degree, which is 4 or more years beyond a bachelor's. So those are the main educational requirements of the majority of the healthcare careers that you may come across. So the national healthcare standards were developed to kind of help indicate knowledge and skills that is expected or required of all healthcare workers, no matter where they work or what they do. So the standards kind of answers the question, what does a worker need to know and be able to do to contribute to the delivery of safe and effective healthcare? So that's kind of the standards themselves. The foundation of the standards of all healthcare careers specifies the knowledge and skill that most healthcare workers should have. So it's saying that most healthcare workers should have communication skills, employability skills, legal responsibilities, ethics, teamwork, and knowledge about the systems in the healthcare environment. That's saying no matter what career you're in, um, an individual should have those skills. Then it breaks it down into different categories. So there's therapeutic, diagnostic, health informatics, support services, and biotechnology. And there's different careers within each of those categories. So under therapeutic, you could have like an EMT, dietitian, dentist, paramedic. What that means is a therapeutic service standard is someone who has the knowledge and skill that are involved in changing the health status of a patient over time. So that includes interacting with a patient, communicating with team members, collecting information, monitoring the patient's status, and evaluating patients' response to treatments. Diagnostic service, that specifies the knowledge and skill required of a worker in healthcare careers that are involved in creating a picture of health or of the health status of the patient at a single point in time. So that includes communicating oral and written information, assessing the patient's health status, moving and positioning the patient safely and efficiently, and explaining procedures and goals. So some of the careers for diagnostic service can be sonographer, radiographer, phlebotomist, a pathologist, um, you know, a cardiovascular technologist, a lot of different services. So they're providing a picture of the health of a patient at a single point in time. The health informatics standard is specifying the knowledge and skill required of workers in healthcare careers that are involved with the documentation of the patient's care, including communicating information accurately within legal boundaries, analyzing information, coding medical records, and understanding operations to enter, retrieve, and maintain information for the patient. So that could be healthcare administrator, admitting clerk, a medical assistant, or a transcriptionist, unit coordinators, people in risk management, patient advocates, an epidemiologist. Those are some of the different careers that would be in health informatics. I don't know if you've ever heard of an epidemiologist or not, but they are actually someone who identifies and tracks diseases as they occur in a group of people and how it develops methods to prevent or control the spread of disease. So an epidemiologist is someone who identifies and tracks diseases as they occur in a group of people and develops methods to prevent or control the spread of disease. So that's someone that's in the health informatics standards career. Support service standards, they specify the knowledge and skill required of a worker in healthcare careers that are involved in creating a therapeutic environment to provide direct or indirect patient care. They include developing and implementing the administration, quality control, and compliance regulations. So some of the careers in support services could be a biomedical or clinical engineer, environmental health and safety, food services, hospital maintenance engineer, a transport technician, people working in materials management, different careers throughout the hospital to help support the hospital and how it runs. Biotechnology research and development standards. They specify the knowledge and skill required of workers in healthcare careers that are involved in bioscience research and development. So that includes comprehending how biotechnology contributes to the health and quality of life. And it also is developing a strong foundation in math and science principles. They follow laboratory protocols and performing biotechnology techniques. So some examples of that could be a microbiologist, a biochemist, a lab assistant, lab technician, toxologist, or a pharmacologist. Those are just some of the different examples. There is a page in your book in Chapter 3, Table 3.2, that will list all the different pathways under each one of the clusters. So under therapeutic, diagnostic, health informatics, support services, and biotechnology and research. So like I said before, therapeutic services careers are directed to changing the patient's health status over time. So workers are using a variety of different treatments to help these patients who are either injured or physically or mentally disabled or emotionally disturbed. Treatment is directed at allowing the patient to function at maximum capacity. And again, like I said, there's many different healthcare careers in the therapeutic cluster. Acupuncturist, anesthesiologist assistant, audiologist, dental lab technician, chiropractor, physician, physical therapist, social worker, respiratory therapy. Places of employment can vary. They can be in schools, home health aides, rehabilitation centers, hospitals, mental health facilities, or even long-term care facilities. And then there's some more examples of them. Diagnostic service, again, the basic job duty is to create a picture of the patient's health at a single point in time. So they're performing tests and evaluations to aid in diagnosing and detecting any diseases or injury or a physical condition. So some of those places of employment, again, are going to be exactly the same. Hospitals, clinics, but there's also pharmaceutical companies, research agencies, outpatient centers, and doctors' offices. Some examples like here are ECG tech, phlebotomist, radiographer, sonographer, dietitian, optometrist. Health informatics careers, again, communicating information accurately within legal bounds. So their basic job duties are to document patient records, maintain their security, utilize electronic health records, analyze information, and create networks for health information. So places of employment can vary a little bit. They can work at law firms, HMOs, insurance companies, research centers, and colleges on top of the hospitals and clinics. Some health informatics careers are admitting clerk, epidemiologist, medical interpreter, translator, a medical coder, or a health information technician. Support services, their basic job description is just to create a therapeutic environment to provide direct or indirect patient care. So they operate support departments in healthcare facilities, and each department has workers at all levels with varying levels of education. So, like you can see here, there's a healthcare administrator, a housekeeper, sterile supply tech, transport technician, a dietary aide. And then the last one is the biotechnology research and development career. So basic job descriptions are to use living cells to create useful products, work with cells and cell products from humans, animals, plants, and microorganisms, and then use research and development to produce diagnostic tests, forms of treatment, vaccines, and food products. So right now it's those biotechnology research and development careers that are forming the vaccine for COVID. So places of employment can be pharmaceutical and chemical companies, agricultural facilities, research labs, colleges, universities, hospitals, or even industrial facilities. So some examples are toxicologist, process technician, forensic science, or biotechnical engineers. So I always thought this little comic was kind of fitting for this chapter. I'm not sure which direction to go now. I was thinking of becoming a doctor, but there's so many options. And that's the thing is there are so many different options out there for careers. So make sure that you're doing your research. Make sure you know what you're getting into. This is something that you're putting a lot of time and effort in to go to school. You want to make sure that, this is something you can do for 20 or 30 years or, as long as you're planning on working for. So in this chapter in the book, it actually breaks down each individual career. I didn't have time to go through all of them, so make sure you look through the book and look at some of the individual careers and what the schooling is required for them. It'll have a little bit of their salary and other information in there as well.